for giving me this opportunity to stand here today to share my experience as well as my knowledge. And I really am greatly honored. Thank you. I am talking about securing in the future the urgent need to train and retain healthcare staff in the UK. So what I will tell you is this. We lost our license last year when we didn't expect it. That was on the 19th of January last year. But contrary to the normal things that are being said about providers, I thought we were ticking every box. Because when we started bringing people in May, we were paying them full salaries regardless of the time they've worked. And we were providing them with accommodation. We were doing everything that we could do. And when we were recruiting people, we were also training them so well and so much because it's a passion. I heard someone mention here that in as much as you are into this business, you cannot go into healthcare business if actually you do not care. And I think that is very important. And he mentioned that getting a profit is a bonus. Getting a profit is a bonus. But the most important thing is looking after people and improving their lives. If you miss that, everything else will not align. You really need to care for people. And it's important. And let's give a round of applause for everyone in the care business for caring. And I always say to people, because what we do, introducing myself, I am Gwinyai Masaka, as you have heard the introduction going. I've been in education and I've been in finance, worked in insurance. I've also worked as a teacher. And I do believe also you cannot be a teacher and you don't like children. You cannot be a teacher and you don't care for young people and their development. So what I have seen is this. When you do not have the right priorities, then everything else, as I said, will not align. So last year, in 2023 up to October, we were paying everyone their full salaries. And what we did was when we applied for our sponsor license, we had over 5 contracts. Now, these contracts were given through councils. But the councils were using proxies. I don't know if you understand what I mean. Yeah. They had proxies. So what then happened was, when we applied for our license, we sent them these contracts to get our license. And then we actually asked them if these contracts were suitable for the licenses. And they said, they are fine. Get your people. So we brought people and we were paying people. But then what happened was, in October, we realized that the councils were no longer interested in taking our people to work. They were now interested in getting and targeting their dependents. Because that's what they were now doing. They were actually going for their dependents. And they were no longer giving us the work. And then I wrote to the Home Office myself saying, I don't understand how this terrain is working. And when I did that, that's when everything just went crazy. They suspended us. They asked for one thing or the other. And the funny thing that I realized was this. They were looking for information that proves that we are not doing well. For example, we have 2 websites. One for training and for supply. And then we have another website for health and social care, for our care provision. They then used the website for training to mean that we were doing things that are not right, even when we contested. And in the end, we ended up taking them to the High Court, and we lost still. Please, don't clap hands for me for losing at the High Court. But all the same, we did lose. But the fact that I realized, what I saw is that over time, history sometimes will show a lot of discrepancies and a lot of things that were not done right, especially in this terrain. Yeah. But all that having been said, we train our staff so well to the extent that everyone who came through our doors will walk out with 18 certificates on face-to-face training. And we'll make sure that a person is equipped to the extent that most of our people who went into the field, most of them, if not almost all of them, were recruited quickly. And when we get our license, thank you, Rumbi. Where's Rumbi? Let's clap hands for her. We are reapplying very soon, and we'll come after our employees. If you have them, we are coming. I'm telling you the truth. If you have anyone from Beacon, I'm coming. Right. When you talk about recruitment and training people, it's one of the most important things that we must never forget. Because what tends to happen is this. Human beings, like I've mentioned in other meetings, are the only creatures with no instinct. Oh yes, we are told that we have maternal instincts and so forth, the other things that we mentioned. But do you know that if you find a sparrow in America and a sparrow in Africa and a sparrow in Asia and a sparrow in the Middle East, they will all build the same type of nest if they have the same materials. You know that? Without being taught. If you find a cow, a donkey, a mouse, anywhere in the world, they will still behave the same. And they have the same instructions. Is that agreeable? Yes. But not a person. Not a person. I was surprised that in India, they pay dowry for the men. Isn't that so? Yeah. In India, they pay dowry for the men. And when Africans hear this, they are so surprised. Because we are not used to what? To that. Because we are humans, we don't have the same instincts. We are different. And what works in us is usually training. But we don't realize that we are actually creatures who are meant to be trained. If we are not trained, we won't do well. Right now, my son sent me a clip of an ID of a South African. And his name is Nevermind. And the middle name is Lord. So it's Nevermind, Lord, and then the surname is there. Why did he get such a name? Because someone decided to give him the name. We don't choose our names, do we? We are given our names. Why can't we choose our own name? Why can't they wait for us to wait and then we give them the name? Because we are creatures that need to be nurtured through training. We are even told names, we don't choose them. Right now you have a name that you have, my dear, what's your name? Patience. Patience. Are we together? Would you have chosen Patience as your name? Maybe, I don't know. Maybe, probably not, probably yes. My name is Gwinyai. When I was in high school, I tried to change my name to Ronald. I actually did. But later on, I became self-emancipated. I said, Gwinyai is the best. So what we must learn is that, what we must understand is this. We are creatures that need to be trained. And even the Creator has made that to be a clear point. How many eyes do we have? Why do we have 2 eyes? So that we may observe how many times? Twice as much. How many ears do we have? So that we may listen. How many times at once? Twice as much. How many nostrils do we have? 2. Why? So that we can oxygenate the brain. I think the good doctor here can actually say, yes, we need to oxygenate the brain. That's why sometimes when you are angry, you breathe faster. Have you ever noticed that? You are no longer normal, brother. When you are angry, you breathe faster. That's why even when you injure yourself, when you are upset, you don't feel the pain. Because adrenaline is working, isn't it? So what am I saying? What I'm saying is that we must observe twice, listen twice, breathe in twice, and how many mouths do we have? And we must speak only? Less. Once. Thank you, less. So we must observe twice, listen twice, breathe in twice, and speak only once. What does that tell us? We are meant to be shaped. We are meant to be malleable as human beings. And in health and social care, it's not a different place. It's just the same place where people should be trained. But the problem with a lot of providers is this. Some of them are into health and social care for the money. And I always say to people, because I also work in consultation in health and in dome care. I always say to people who are coming into dome care, don't think of any money coming your way until 3 years is over. And I always tell people that. And some people get money the first year, they go crazy. The second year, they go crazier. The third year, they are not even attending the office. They are not even coming. But they don't understand the principles of working in health and social care. It's the place that you should train people until you are tired of training them. And when you're tired of training them, train them some more. No, I need you to know. But the trouble is, we think because training is an intangible, we don't see the results straight away. But we see the results in the way that people behave and work. Do you know that a lot of us waste a lot of time dealing with toxic issues? That could be avoided. So a lot of things could be avoided. A lot of toxicity could be avoided and eliminated if staff were trained. Not only staff trained, and the managers ourselves what? Trained. When we are trained, we sharpen and hone our skills so that we are able to operate better. That's why we need to clap hands for functions like this. Let's clap hands for this. You need to keep on training them. And most of us don't realize that we actually lose. The healthcare system is actually having a staffing crisis. I think Rumbe has already mentioned that. I won't go for much onto that. Can we move on, please? Right. In the NHS, over 120,000 vacancies. And did you know that by 2030, the healthcare sector is believed that the number of people in care are going to double? Did you know that? That's what they're saying, that it's going doubling by 2030. And 2030 is not far. And another thing is this, what we've also realized, that there are some statistics that they're not even taking account of. For example, with social workers, we've been told that, and commissioners, that what is happening is a lot of elderly people who are dying were actually looking after their own children as carers. And as they die, these people are being released into the care system. That was not even accounted for. So the doubling is happening, and people are being released into care who are being supported by the elderly what? Parents. Now the business will grow. It will continue to grow. But the issue is, a lot of us have been opportunists. Because of the bandwagon of what has been going on, we've jumped in. Why? Because I'm a nurse. I'm now into the... Why? Because I'm a teacher. Why? Because I'm a social worker. Why? Because, I have a pot of money here, let's get into business. Why? Because the reasons are many, isn't it? But the issue is, when we get in, let's then sharpen our skills. Rumbi has mentioned that there are now even going to be more compliance visits, desktop compliance. Did she mention that? I think I heard her say that. So what it simply means is that we need to be really, really sharpened in our own skills. And we should also train our staff. And we should find ways. And the funny thing is that most of these overheads are deductibles. I think Blue Hector, where's Blue Hector people? Yeah, I think they can vouch that these are deductibles. Is that right? And what does that mean? Yes, if you could just say one thing, please. It reduces your tax bill. So in other words, you are trying to save where you should not be saving. Are we together? You are trying to save where you should not be what? Saving. You should be investing. And then you take out very little. But most of it, you put it back through training your staff. Now, of course, moving on, please. Burnout and mental health. Now, United Kingdom is a hub of mental health issues. Did you know that they say 1 in 4 adults has a mental health issue? But these are people who are, remember, these are people who are self-confessed, who have gone to hospital. You and I have not gone there. So the 1 out of 4 is a wrong statistic. No, it's a wrong one. It's more than definitely 50%. Why in this nation it's like that? It's very simple. The sun goes down